All right, so my name is Jonathan. I'm going to be examining PG, and we're going to do a complete physical assessment. Hopefully, it's more complete. What is your occupation?
I'm a brother.
A biller. Okay. How old are you?
25.
So, PG appears to be 25. He appears to be his stated age. He seems alert and ordinate times three. His skin color is olive to tan skin tone. He looks relatively healthy. Um, he has good posture sitting up, in good position, looks comfortable. His face, his facial expressions look appropriate for the situation. He's his speech is normal, clear, articulated. He has seems to have no hearing deficits, and he looks well kept, well groomed. Good health hygiene. All right. He appears to be approximately 210 pounds. How much would you say you weigh?
About 212.
About 212, so pretty close. About 5 feet 9 inches tall, approximately. Okay, so here we would start by using maybe the Snellen eye chart. We don't have one here currently, but if we did, we would have him stand about 20 feet away from the Snellen eye chart and tell him to read down the lines. And depending on where he couldn't read anymore, that would be the his vision test, and that would tell us his eyesight. He does wear glasses. Obviously, he has them on right now. Then we're gonna go to the radial pulses. Just check here his hands. Um, he has good pulse, good rate, good rhythm, equal bilaterally. They're both strong. Respiration wise, he looks like he's taking good deep breaths. Full chest expansion on that. And that's about it for the general appearance and general survey of the patient, or PG. Skin, it looks intact. No lesions are noted. Skin is warm. His turgor, he had good turgor, good elastic turgor returns. Fairly looks like he drinks enough water. That is hydrated, as I said, and there was no lesions. Let's see here, if I'm missing anything. Maybe I'm missing something. Let's go to his head and face, okay? Can I remove your glasses? Alright. So let's remove those. We're gonna go and look through the scalp now. Feel for any deformities. Look all the way around. You would look all the way around the scalp just to check. It looks good. No, there's no flaking. It looks like it's in good health. No deformities on the head. There's no lesions. No bumps or bruises. Let's see. What else? The face. His face looks symmetrical. We can go ahead and while we're here, feel his sinuses. Is there any tenderness? No tenderness. Okay. But his sinuses are good. And let's we can go and feel your temporal artery. Pulse is felt. We can feel his TMJ open and close. Alright, smooth movement, no abnormalities there. While we're here, we're gonna go ahead and feel for the lymph nodes, submental, sublingual lymph nodes. No enlargements there, okay? Feel for his carotid pulse. We're okay with that. Let's see here. Moving on. Carotid pulse. What else do we got? All right. We're gonna start by testing the visual field. Oh, visual field. Okay. Um, we're gonna start with the corneal light reflex. Okay. Just look straight ahead for me. So his pupils are curled. The pupil, equal and reactive and round to light, and they're accommodating. You would check the accommodation by telling him to focus on a further away object and then bringing my finger into view and telling him to focus on it. closer in and checking if they're accommodating to that. We can use the pen light and ask him to follow the pen light to the 6 cardinal positions without moving your head. Testing the cranial nerves, the extraocular movements. And it is intact there. Okay? Let's see where we at. We can use next. We can use the ophthalmoscope, if I can even say that right. We will be looking for the red light reflex in his eye. Alright. Alright, let's start. Let's see. So we're going to find the red light reflex. Then we're going to chase that red light reflex into the eye. And we're going to find a vessel. And then follow that vessel to the optic disc. Okay? Alright. A little easier said than done. But I could find the vessel. It takes a little practice to keep track of them, but with practice you could find the optic disc and examine that. Okay, did the ophthalmoscope, red light reflex, the disc, vessels. Now we can move on to the ears, okay? Check the external structures, symmetrical, asteroid. Okay, then we can use the otoscope to look at his ears. Turn it on. And check the internal structures. Okay. The tympanic membrane was intact. Pearl-like shiny resemblance. So we're good there. Ears, eyes. Now we can go and move on to the nose. The nose looks symmetrical. Doesn't look like he's ever fractured it, broken his nose in an accident. We can check the patency of the nostrils. Asking him to breathe in and out through one nostril and then the other. We could also inspect it with the otoscope. Okay, can you tilt your head back? Okay. Breathe. Find the turbinates, the septum. Those are intact. Good mucous membranes there, with the color being pinkish red. No swelling noted. Alright. Next is mouth. We can go to the mouth and show area, okay? We're gonna inspect the inside. Let's see here. Where is my pen light? We got a pen light. The stick, okay? We're gonna ask him to open his mouth. We're gonna take a look at the inside, his teeth, his hard and soft palate, tonsils. No any swelling on those, and we can test a couple of the cranial nerves there as well. Okay, can you open your mouth? Stick out your tongue. All right, now let's see here. I'll do it this way. Say ah. Okay, so we got that. We're gonna look around. Oh yeah. So oral mucosa is good. Moist, red, hard and soft palate are intact. No deformities there noted. All teeth are present. All right. And the uvula, as we were testing, when he said ah, we were testing for cranial nerve 9, 10, the tongue, with him being able to stick out the tongue and move that cranial nerve 11. I mean 12 actually. Next we kind of already did some of the neck. We checked for the symmetry of the neck. We checked for lumps. Palpated for the carotid pulse. Okay. Trachea, as noted, is midline. Um, can we do some range of motion with your neck? Left, right, front, back. A good range of motion there, and no pain upon the range of motion. Okay. So next we have thyroid glands palpation. All right. Then you turn to the right side. All right. So come here. Okay. Now, this corner. All right. We're feeling for the thyroid gland. No rough edges, smooth, and present that we could actually palpate it there. And it was no rough edges. It was smooth. All right. Next we're gonna move on to the chest, posterior and anteriorly. We can go ahead and we're gonna do the back first. Okay. The back first. Have them turn to the left here. And we're gonna lift up your shirt, okay? Alright. So here we're examining the back, looking for symmetry, good muscle structure here. The spine is in line. We can go ahead and feel for that. And it is straight. Alright. Let's go ahead and tactile fremitus. Can you say 9-9? 9-9? 9-9? 9-9? Okay. So that's good. It's normal, no consolidation or no noting of possible fluid buildup in his lungs there. Now we're gonna go ahead and listen to the lungs. All right, lungs are clear bilaterally there. Let's see. As he's breathing, we can note that there's symmetric chest expansion. Like we said, his spine was straight, in line. We can percuss over the lung fields, and we probably hear resonant sounds. Then we can check for the CVA tenderness for his kidneys there, and no adventitious sounds were heard. We're gonna go ahead and just check the CVA tenderness here. Nothing. Okay. Okay. So no pain or tenderness with that. All right. Next, we're gonna go to the front of the patient. Have him turn back around here, and we're gonna go again and listen. And again, lungs are clear bilaterally there. We could also do the tactile fremitus again, and check how the sounds of him saying 99 in the front would be again. Next we could we're just gonna inspect, clear, listen, clear bilaterally, inspect their good chest expansion once again. No obvious deformities. Let's see what else we got here. We can percuss the lung fields. We can go ahead and do that. Let's just go ahead and do that. So resonant resonant sounds throughout there, the thoracic cavity there, as long as you're not on any ribs there. Okay. Next, rest sounds we percussed. We're gonna listen to the heart sounds. Start at the pulmonic, aortic actually. And we go through the aortic, pulmonic, tricuspid, and then the apical pulse, which is the mitral valve sounds. Um, all those we can hear S1 and S2. Rate and rhythm were regular. No murmurs were noted. No swishes. Nothing like that. Okay. We would listen to the apical pulse for 1 whole minute though, and we would try to know anything on that. But heart rate, heart sounds are good. Okay. Next, we would look at the his upper extremities. His upper extremities are symmetrical. Um, no lesions noted on those. We we checked his pulses earlier, the radial pulses. His hands and his fingernails look symmetrical. Nail beds are nice and pink. Cat refill is good. Okay, we can go ahead and check while we're here in the upper extremities. We can go ahead and check the reflexes. Once again, practice is needed in this, but here we can just tell him to relax his hand, and we're checking for the brachioradialis reflex on this one. Small reflex noted there, but kind of hard to get sometimes. Then we're going to come to the biceps reflex. Here for the biceps tendon, and we can strike our thumb here and see if we get a reflex. Slight there, but practice. I need to practice this. We will do the same bilateral on that side, and then we can come check the triceps one. There's multiple ways to try it. We can tell him to relax as he is there, or we could go ahead and pick his arm up, and we can support his whole weight and, and strike it at the triceps tendon here. Okay. Let's see if you noted any. Grab it with my left hand, and see if any noted reflexes there. All right, moving on. Got those. Did the heart reflexes on the upper extremities. His hands, his upper extremities are warm. Sensation is there. Let's go on. Checking my papers just to make sure we're not missing anything. Let's see here. All right. Next thing we can move on. We already checked the chest. Percussed, listened. We were looking. Now we're gonna go to the abdomen. We can just have him lay down. All right. So we're gonna lift up your shirt here, okay? All right. We're inspecting first, looking, make sure there's no abnormalities, no pulsations anywhere in the abdomen, okay? Next, we're gonna go ahead and listen first before we palpate or percuss. Didn't take too long to listen through those because the bowel sounds are active and present. Next, we would palpate. Sometimes people are ticklish. You gotta be careful. Right. No abnormalities felt there. We can go ahead and listen for any Brills. I mean brills. Thrills or bruise. Mix the two words there. No bruise were heard. No thrills can be felt. All right. Next, we can go to the liver in that right upper quadrant. We're gonna go ahead and tell them to breathe in whenever I go to start the palpation there, and then we're gonna tell them to exhale. And we're gonna feel for that border of the liver coming down. All right. Breathe in. All right. Breathe out. All right. You can feel the liver in that right upper quadrant right there, to the bottom border of it. All right. Usually the spleen on the left upper quadrant is not usually palpable, but if it was, it would mean that it could be enlarged or inflammation there for some reason. So when we come to the border of the last rib here, see if we can palpate it. But the spleen is not palpable there, okay? Next, we can go ahead and have him sit back up. All right. And we're going to look at his lower extremities. So lower extremities are, once again, they're symmetrical, no abnormalities are noted. Good hat refill on the toes. We're going to check for pulses on, let's see if we can do this. Oh, there we go. Check for pulses on the dorsal of the dorsal side of the foot. Feet out. I can't say that right now. The dorsal side, whatever. Then the post-tibial. And we got good, strong, equal pulses there, okay? Next, we could check for reflexes. We can check for the knee, and then we can check for the ankle reflex here. Make sure his foot is relaxed. And that could be felt. And that one goes good. Next, we can do the knee here. Put that there. Slide it maybe. I got it on there. Alright. So reflexes were checked. Patient's skin is warm on the lower extremities as well. Reflexes look good. They're present, not absent. So we're gonna continue with this, okay? Let's see, sensation. We can check sensation with. Let me see a dull. Need a dull object. If we can find somewhere. Okay. Let's try. Use that one. I'll use a tip of a pencil. We can do this. Use this one for a light touch. Alright, we're going to use sensation of the face first. Just close your eyes and tell me if it feels the same throughout. So sensation is good there. We can check on the arms here. Light sensation touch here. Look at that. Okay, now I'm gonna either poke you with a sharp or dull object, okay? And just tell me the difference and where. Okay? Okay. Not quite. Just very similar, I guess.
No.
Okay. Alright, that's better. Okay, so sensation is good there. Now we're going to do the same to the lower extremities. Okay? Okay, so that's good there. Okay, for sensation for extremities times 4. Okay. Now we can do finger to nose, test the function. Um, finger to nose. Okay. Let's see. Which one do I want to do first? And we can do the heel to shin as well. Or we can just do the heel to shin. And what we have him do is take his heel and run it up and down his shin. And we can do that one both sides. Alright, so we can do that. Now finger to nose. Finger to my finger. Oh, to your nose, to your nose.
Oh.
Yeah. Finger? No. Finger. Alright. You're getting that one there. Alright. So we already did the reflexes there. I think I'm getting close, but maybe not. Check lungs, heart, chest, thoracic, anterior, posterior, abdomen, sensations of face, check lymph nodes. We can check the axillary lymph nodes. What we do is have him lift up his arm, and we would just deep in there. No swelling there, okay? And those axillary lymph nodes. And we can also check the supraclavicular lymph nodes. Since we already did the neck ones, we're okay for that one. Oh, we're good there. No swelling noted. Alright? Last but not least, we could ask him to stand up and do a heel to toe walk across, just to check, and then we can check some range of motion. Alright, if you can do that, we can stand up, and we can see him walk across just a little bit from heel to toe, check his balance. It's okay there. Alright. Now, just could you squat? Just check some flexibility, range of motion there. And can you bend at your waist? Yeah, just bend. There you go. All right, we're good there with that range of motion there. That pretty much wraps it up, I believe. I don't think I missed anything. Let me just run through this. The paper just to make sure. All right. One more thing that we could do is the tuning fork test, which I don't have the tuning fork, so I didn't test him, but you could do the Weber and Rhine test for that to test his hearing, his conduction, and all that. Other than that, I pretty much think I covered everything. And that was a complete health assessment by Jonathan and PG. Thank you.